This video is for you if you have been asked to do home blood glucose monitoring to screen for gestational diabetes, as in to check whether or not you have developed gestational diabetes in your pregnancy. You will have been given a brand new Contour Next meter, you will have been given a blood glucose monitoring diary, and a get the test strips you need note for your GP. Please eat normally while you're doing this week of testing. If you were to change your diet and limit certain foods, for example sugary foods, in a way that you don't usually do, this may not accurately reflect how your body copes with those foods. So please just eat as you usually do. Please don't change it. Please test your blood glucose in the morning before you have breakfast. We call this a fasting blood glucose level, although you don't have to fast the way you would for surgery, for example. However, we would like you to have at least 6 to 8 hours between when you've last eaten on an evening and when you do the test on the morning. And usually we would ask that you would just drink water or no added sugar drinks during the night in order to not affect this result and to get a clear result of how your body handles you not eating through the night. We want this level to be less than 5.3, written in this column here. If the result comes back at exactly 5.3 or above that, it is a high result. Then we would like you to do a test 1 hour after your main meal. So for example, if your biggest meal of the day is in the evening, finish it and 1 hour later do your blood sugar, and we would hope that it would be less than 7.8, made a note of here, and again if it's exactly 7.8 or above that, it is a high result. Please do not eat in the hour after you've finished eating your meal and when you do the test. So for example, if you want to eat a yogurt or a piece of fruit or something after your meal, do that directly after the meal and then test 1 hour after you've finished eating that, rather than finishing your meal, for example, at 6:30 in the evening and then eating your yogurt at 7 and then doing your test at 7:30, because the yogurt will affect the result and not give a true reflection on how your body has handled the meal. Please do these tests 2 a day. You can start the evening that you get your blood sugar meter. Please do 2 every day, because if there are gaps it makes it very hard for us to interpret whether or not you've got gestational diabetes. And please call us after a week and give us all of the results. You can also leave them on a voicemail on this number here. This number here will be answered if there is enough staff to do so. However, I would like you to phone sooner if you notice 2 high results. These 2 high results do not have to be consecutive on the same day or on the same time of day. It could be a Monday evening and a Thursday morning. In that case, ring us on the next working day, which would be a Friday. You can leave us a voicemail anytime and we pick up our voicemails every morning. If you have any urgent concerns, as in if you feel unwell or have any pregnancy concerns, please ring the MAU, which is the Maternity Assessment Unit. It's a 24-hour unit, and this is the number for that here. You have got enough equipment in your Contour Next meter to do the test for a week. If you get no high results at all, we will speak to you and let you know that there is no evidence of gestational diabetes. However, if you get 1 or 2 high results, you will need to continue testing for longer. And if you do get 1 or 2 high results and need to continue testing, as well as phoning us, please also get in touch with your GP and tell them that you need some Contour Next strips and some microlet lancets. So these are the equipment that you need to continue testing. You will also need a sharps box to dispose of your used needles after you have pricked your finger with this kit. A sharps box can be gotten from the GP. It looks a little bit like this. If you do not manage to get a sharps box in the first few days of testing, please put your used needles safely into a glass jar, for example an old coffee or jam jar with a lid, and keep it up high. Always store your sharps box or your jam jar up high, away from any children in the house. And then once you have got your sharps box, please put your used needles from the jar into that. Never put used sharps needles into the bin. If you get too high results, we will say that is enough evidence of your body struggling to say you have got gestational diabetes. This is a brand new Contour Next meter. You do not need to return it, it is single patient use only. There is a user guide in case you have any questions or need to understand something else about this video. Of course, you can also phone us to discuss it with us over the phone. Please wash your hands before you do every test with soap and water. If you were to use alcohol gel or sanitizer gel or a baby wipe, for example, this would give an inaccurate result. So the most accurate way to get a result is to use soap and water. Please take your lancing device out of the pack. Take one lancet or needle. Lancet is just a different name for needle. The colours do not mean anything, they come in all sorts of different colours. You have the meter itself and you have a pot of strips. So you can take one strip out to have ready for when you need it and keep the lid on the pot closed all rest of the times. First thing you need to do after you've washed your hands is unlock the lancing device. So you're moving this little notch here to here, and then you can open it. Put the lid down, take your needle, holding it by this round end, and push the square end down into the middle of the lancing device. Twist the cap of the lancet twice and pull it off and keep it to one side, exposing the needle. You then need to take your cap of the pen device, line up these two notches again and lock it. Very important that it's locked. These numbers refer to how deeply the needle will prick your finger. So you are going to hold the pen device against the side of your finger and press this button here to prick it. 1 is the lightest setting. If you don't get enough blood, please make it 1 setting deeper. And hopefully you'll get enough blood, but if you don't get enough blood, make it a little bit deeper. 5 is the very deepest. You need to use these fingers more than your index and thumb finger, so primarily these fingers, and you always want to do the test up against the side of your finger, so here, and then the next time you can move it to a different finger or a different side, or here, or here. So once that button has been pressed, you need to pull this white end of the pen out, and that will reset it. So you would hold it firmly up against the side of your finger, very, very firmly, and this is the button that you will press to fire the needle. So again, I'm going to reset that one. Before you prick your finger, please prepare the meter. So you take the strip with the logo side facing up, the square grey end goes into this groove in the meter. You push it in all the way and it automatically switches on, and it will ask you for some blood to be applied. When you do apply the blood, it will ask you whether you are fasting, before a meal or after a meal. So 3 options will come up after the blood has been applied, and you use your arrow button or your OK button and your OK button to clarify whether you are fasting, as in you're before your breakfast, or whether you are after food. You do not need to use the middle option of before a meal. This refers to before the afternoon or evening meal. So I'm going to get my practice blood ready. Okay, so this will be my drop of blood on my finger. So you hold this really, really firmly up against the side of your finger, and then you press this button here. I won't do it to myself. Then you put this pen device down, you squeeze your finger, and a drop of blood should be seen. Give it a good squeeze from the end of your finger, the base of your finger, like this, rather than just squeezing from the top. Squeeze it from down here, just gently stroking down your finger like this, so you have a nice drop of blood sitting there. Then, very important, the way you get the blood onto the meter is you just touch the strip to the blood. It pulls it in and beeps when it's got enough. I'm going to call this an after meal setting. Press OK. And because I'm using control solution, it says control test. Yours won't say that. And then you get a result. You have a tissue handy to wipe the blood off your finger. And then you use the tissue or another tissue to pull the strip straight out of the machine. The machine automatically switches off at that point. The machine does record and store in the memory all of the results, including the time and the date, and whether it was a fasting or after meal setting. Your used strip can be disposed of in your normal rubbish bin at home. Then the best way to get rid of your needle safely is to take the little cap with the circle side facing up, place it on a hard surface like your table. Unlock the pen device and pull the lid off, and then press the needle into the lid. So I'm just very firmly pressing it down, not putting the needle anywhere near my finger, and stabbing the needle into the lid. I can then push the needle straight out rather than pulling it out. Avoid doing that with this little slider here. This button here, that just pushes it out. Because I have a sharp spin here, or you would use your jar, I'm going to put it straight in there. So you just use this slider button to do that. So again, please ring the diabetes midwives after 1 week with all of your results, please. And if you get 2 high results, we would like you to ring as soon as those have happened. So next working day after you've had a second high result. If you get 1 high result, you can still ring us after a week, but do go ahead and order more of the equipment from your GP on prescription.